Namaskar, welcome to Supreme Samachar. Age 40, name Siddharth Shukla, recognition Big Boss winner, outcome died of a massive cardiac arrest or a heart attack at the age of 40. What's going on? Today is the heart day. I want to speak to a cardiologist to understand the reason of cardiac arrest and heart attack. The world, the people of this great country should know the reason behind it and the preventive measures so people can remain safe and far off this disease named as heart attack. Joining me is Dr. Anandram, a senior cardiologist who will shed light on this grave concern which is pestering the entire world and eating up our youngsters and the people of all ages. Doctor, welcome.
Hi, good afternoon, everyone. Myself, Dr. Anandram. I'm a consultant intervention cardiologist at Wokhart Hospital, Meera Road. And first of all, I will congratulate on World Heart Day to everyone. And I will discuss little topic on heart attack in younger age. What may be the causes? And recently, I will discuss one more case which I did. Like there is one 23 years young male patient came in emergency with a chest pain, and how he went through the all emergency process and with the angiography, angioplasty. We'll discuss in depth with that.
Doctor, to be very honest, you said congratulations, but to be honest, looking at the figures, right, the people are getting impacted, right, the people are having heart attack in such massive numbers. It's very unfortunate, very, very sad. And honestly, people do not have even the iota of an idea at what's going on with their life. They are living in denial.
Yes, I totally agree with you. I think I have to continue with my case which I did previously, and then I can answer each and everything whatever you asked me. Like this case includes each and every aspect of the younger age heart attack. This patient, which was just 23 years old, is non-diabetic, non-hypertensive, and no other risk factor. He had a chest pain in last 3 days, and he just ignored it. And on the day of emergency, before coming, he climbed sixth floor by himself because lift was not working. Then he came in emergency with a severe chest pain, and during in emergency he had a one episode of cardiac arrest, and that arrest was reverted with the giving a DC shock, which I can say in simple language like giving a bijli ka jhatka. And with that, with the some CPR and medication, he reverted back to the life. And then we have taken that patient for the angiography. And during angiography, it was the main artery of the heart, which I can say the left entry descending artery, it was 100% blocked. And I was very shocked at this early age of 23 why someone can have this kind of blockage which is 100%. And then I went ahead with doing angioplasty for that patient. And during angioplasty also he had one episode of cardiac arrest. Then again he got reverted with the DC shock. And after the angioplasty he got stabilized, and he got discharged from the ICU after 3 days. And just look at the each and every aspect, and followed by we did an investigation. There is one factor what I can say, his homocysteine level was 170. Normally the range is up to the 10. And just one small factor I can homocysteine, if it has controlled well with that, I think he have avoided this massive attack. And let's look each and every aspect. On the day he had a chest pain, he missed for next 3 4 days. He ignored it, and considering his age, definitely this might possible. Everyone may ignore this kind of chest pain, because as age of 20 30, someone having chest pain, he just thinking maybe gas ka pain, maybe sone se pain, maybe some kuch khaya hoga. This might the misconception people have. Uh, Basically, particularly you have any kind of chest pain which is on left side to left arm going to back with the vomiting sensation, definitely some maybe possible you have cardiac. Rather than ignoring, get a ECG done. That is the best idea you can have it. And then coming to emergency, some people go like कि मैं गैस के टैबलेट लेता हूँ पहले थोड़ा सा एक्सरसाइज कर लेता हूँ ठीक हो जाएगा. This is not ideal way. If you have any kind of pain, come to the hospital like this patient came. If it had delayed for next 10 minutes, he would have died definitely, because out of hospital he had cardiac arrest. No one can revive other than DC shock. So he came on time within 20-30 minutes of having heart attack. We did a DC shock. He got reverted, and on the within 20 minutes we have taken a patient to cath lab. But this is the importance of knowing the procedures, what to do after the heart attack. We have taken the patient for the angioplasty on the spot. Within 30-40 minutes, he got the blockage open. So this timely intervention saves the life. That is important.
डॉक्टर साहब एक बात बताइए कि क्या उस पेशेंट की स्मोकिंग और अल्कोहल हिस्ट्री थी?
उस पेशेंट की ना ही अल्कोहल थी, ना ही स्मोकिंग थी, ना ही फैमिली हिस्ट्री, ना ही कोई बैड हैबिट्स थी. He had just one thing, obesity, and along with the homocysteine level, which was way beyond normal.
डॉक्टर साहब मैं तो डॉक्टर नहीं हूँ, ना इन चीज़ों को ज़्यादा समझता हूँ, लेकिन एक फिगर मेरे पास है। आपसे मिलने के पहले मैंने आपके कुछ पेशेंट्स को कांटेक्ट किया, आरएनडी किया। क्या ये फिगर सही है कि कोविड-19 के बाद में कार्डियक अरेस्ट या लूज़ली हार्ट अटैक जिसे कहते हैं, इन चीज़ों में एक ज़बरदस्त और डेंजरस इज़ाफ़ा हुआ है?
आपकी बात कुछ हद तक सही है. आफ्टर कोविड एरा के बाद दिस 2030 के एज में हार्ट अटैक है 30% इजाफा हुआ है इसमें. और इसमें इजाफा होने का कारण कई सारे हो सकते हैं. जैसे कि कोविड के बाद कई लोगों ने अपने नियर एंड डियर वालों को लूज किया है. दैट इज अ स्ट्रेस. कई लोगों को साइकोसोशल 2 साल का लॉकडाउन, लॉट्स ऑफ पीपल हैव लॉस्ट देयर जॉब. द साइकोसोशल स्ट्रेस and the is lockdown में people not allowed to go outside, so they have like more taking like food from the junk food and the Zomato, Swiggy, whatever the things, that they have multiple access to the junk foods also. And in this era, stress has gone increased, and somehow COVID is also one of the factors which has led to the stress in the body, in the sense cytokine stress. And there is some increased thrombogenicity in the body after the COVID era also. This is because of COVID virus, this which it does to the body is the effect of that. That's the reason many people are getting heart attack nowadays more and more.
डॉक्टर साहब एक दिल की बात और एक अंदर की बात दोनों पूछूंगा। डेवलप्ड कंट्रीज जैसे कि जर्मनी है, स्पेन है, यूनाइटेड किंगडम है, यूएस है, वहाँ की जो गवर्नमेंट है एटलीस्ट अवेयरनेस कैंपेन चला और इफेक्टिव अवेयरनेस कैंपेन और डेटा है डब्ल्यूएचओ के साथ में मिलकर। Are you satisfied the steps government is taking at least to increase the awareness? जागरूकता आपको लगता है गवर्नमेंट स्टेप्स ले रही है या एटलीस्ट म्युनिसिपल बॉडीज के लेवल पे काम होगा?
जागरूकता कुछ हद तक तो है, बट अप टू द नॉट अप टू द मार्क, बिकॉज I did many camps in a multiple corporate hospital, multiple corporate banks and corporate employees also. If I check approx for 50%, that approximately 20 to 30% patient who don't know they have cardiac problem. They don't know they have diabetes also. They don't know they have hypertension also. Many of patients, if they are taking medication, that's not up to the control. That's not up to the mark. That is the thing. Accepting the first thing, I'm a patient. I'm having some problem, and then secondly, acting on that disease. That is the important one.
डॉक्टर आपने बीमारी के बारे में बताया, आपने एक एग्जांपल दिया जो कि बहुत शॉकिंग था। 10 मिनट में अगर पेशेंट यहाँ पे नहीं होता फिर वो कहाँ होता हम सोच सकते हैं। एक बात बताइए, कुछ प्रिवेंटिव मेजर्स की बात करते हैं, लाइफस्टाइल जिसमें बहुत इम्पोर्टेंट है। What are the measures an individual can adopt or embrace or can take जिससे कम से कम जीरो तो मैं नहीं कह सकता लेकिन रिडक्शन जरूर हो इस गंभीर बीमारी में?
फर्स्ट ऑफ ऑल, अभी जो स्पेशली यंगर लोगों को बोलना चाहूंगा कि दो स्पेशली कॉर्पोरेट पीपल, दे हैव हैबिट ऑफ स्मोकिंग. फर्स्ट एंड फॉरमोस्ट मोस्ट इंपॉर्टेंट फैक्टर फॉर यंगर एज हार्ट अटैक इज स्मोकिंग. आपको स्मोकिंग एज मच एज पॉसिबल कम करके उसे बंद करना होगा. आई नो इट्स नॉट पॉसिबल इन वन डे, बट इफ यू कैन टेक वीक और 2 weeks to reduce this and replace with something else, maybe nicotine chewing gum, maybe something else, maybe possible you can stop it completely. Second thing, the people don't exercise at all. Like recent Lancet study was published, approximately 50% of Indian population are physically inactive. That's the very big data. आधे लोग इंडिया के लोग एक्सरसाइज ही नहीं करते. एंड इफ यू डू 30 minutes of daily walking, daily exercise every day, you reduce your chances of any cardiac event by the more than half. And many people, they won't able to sleep in night. Like they have less amount of sleep because of lots of stress, lots of workload, anything. If you take a 6 to 8 hour daily sleep and do daily 30 minutes exercise, eat regularly, keep your blood pressure, keep your diabetes within one control, and control your weight also. And far most important, once a year, get a regular body checkup. Regular body checkup means get a ECG, get a 2D echo, and get a lipid profile, control your cholesterol within the normal limits. And if you're having any cardiac symptom, getting a stress test is always important one.
डॉक्टर साहब एक डीप बात मैं आपको बताता हूँ। भारत को योग गुरु, ठीक है, हमने यूनाइटेड नेशन में इंटरनेशनल योगा डे भी की स्थापना भी करवाई। इज डूइंग योगा, मैं साइंटिफिक पॉइंट ऑफ व्यू से पूछ रहा हूँ, जो आप बता सकते हैं इसमें, इज डूइंग योगा और मेडिटेशन और प्राणायाम कह लीजिए, अनुलोम विलोम कह लीजिए, क्या इसका असर सकारात्मक होता है इन चीजों की गिरावट में?
Yoga, meditation, these are the primary things which control your body. What I can say, if any patient like younger age, one 30, 40, he coming with me, like he had diabetes, he have this blood pressure. First and foremost, I advise lifestyle modification along with the yoga and meditation. These are the first and foremost decrease your BP and the stress up to the mark. Medications come secondary. First comes your lifestyle. Lifestyle includes stress management with the yoga and meditation. This is the most important. And the many research have been published till now. It has shown meditation has a maximum effect on blood pressure also. It reduces on a longer, but it will not come in a day or day month. It have practice of longer. Like you have to practice for a few months, maybe 6 months also. Then you'll start having the effect, and that effect will remains for your lifelong if you continue that meditation and yoga for lifelong.
In our everyday life, everybody says sorry to each other. It's like a normal thing. हमें माफी मांग, लेकिन जब एक डॉक्टर सॉरी बोलता है, आई एम सॉरी, इसका मतलब क्या है मुझे बोलने की जरूरत? Which is or which was your toughest story in your life that you couldn't say?
Luckily, in my practice, since last 2 years in Mumbai, I haven't said sorry to anyone because all my cases have done very well with the zero mortality. That was the unique beauty of my hands. I don't know, this is God grace. Till now, I haven't lose even single patient which I've did intervention on the patient. And what I can say, that is the toughest thing we have to explain the patient is something has happened to someone, that is all because of the condition of the patient. He may have the massive attack. He might have the ejection fraction, what we can say, outcome pumping power very low. That is the other factors which is there. We cannot save all the patient. Like we try our best, but sometimes there's something fate we cannot change also that.
Right. One last question before I wrap this interview, doctor. What is the first thing a patient or the family member surrounded or around can do the moment they sense there's a possibility of a heart attack or a cardiac arrest? This is not related to coming to the hospital, at the home itself, what they can do.
First and foremost, identify the symptoms you have heart attack. What I can say, I repeat again, if you have any kind of chest pain, maybe the left side, maybe right side also, maybe that pain may relate to left arm, may sometime go to right arm also, maybe go to the jaw also, and you have like pain के साथ साथ समटाइम पसीना भी आता है, घबराहट भी होती है, कई लोगों को वोमिटिंग भी होती है। एंड सबसे कॉमन जो लोग मिस अंडरस्टूड करते हैं, लाइक एपिगैस्ट्रिक पेन, जो पेट के ऊपरी हिस्से में पेन होता है, लोगों को लगता है ये गैस्ट्रिक पेन है, बट मेजर कई बार ये हार्ट अटैक भी होता है लोगों को। तो ऐसा कोई सिम्टम आता है, इफ यू लाइक टिपिकल सिम्टम फिट होता है, तो आपको घर पे एस्प्रिन 150 मिलीग्राम की रखनी चाहिए। 2 टैबलेट आपको च्यू करके लेनी है और रश टू द हॉस्पिटल एज सुन एज पॉसिबल। मेक द पेशेंट रेस्ट, डोंट मेक हिम मूव, मेक हिम रेस्ट एंड कम टू द हॉस्पिटल एज सुन एज पॉसिबल, नियरेस्ट जहां पे भी कैथ लैब अवेलेबल हो। अगर आपका सिम्टम है, गेट ईसीजी डन, गेट इको डन, then diagnose and then followed by intervention if needed for the patient.
Doctor, you are very soft spoken. You threw a lot of informative light on many of the subjects, basic information which are really effective. You give it to us on this hard day. I can say one thing to you, Dr. Anandram, that you have a golden heart. I know I've spoken to many people who knows you, okay, and I hope and believe that you stay lucky and you never have to say the word sorry. Thank you so much for taking out time. I know there are a lot of people waiting outside. They trust in you. You are like next to God for them. Your last message to this great country and the people on this hard day.
What I can say, take care of heart and take care of the heart of the loved being which is near to you. Always take care of them.
Okay. We were talking to Dr. Anandram on the Heart Day. I understand that we all have a golden heart. In fact, many of the people have a golden heart. This is the high time to take care of the heart. How can you take care of the heart? Check what you're doing in your life, improve your lifestyle, and most importantly, which I believe in, be good to others. This is Amit Saraswat for Supreme Samachar. I would say keep watching and Jai Hind to everybody.